name is Louisa Lussier. My job title is Director of Operations and Compliance. I work at Baby Space in Minneapolis, located in the East Phillips neighborhood. The early childhood workforce is important to me because there's always going to be children and families that are in need for quality care in a childcare setting. My position entails making sure that the program is running smoothly, everybody is following the policies and the expectations from Baby Space and DHS.
My name is Eastman. I'm an early childhood mental health consultant in the Twin Cities metro area, and I'm also the director of pediatric mental health at Mino Bimatsu and Wellness Clinic in Minneapolis. So as an early childhood mental health consultant, I contract with different daycare centers and early childhood centers around the metro area, and I go in and I work with the director and the staff. And if they have specific questions or concerns about certain classrooms or kiddos around mental health, I go in there and I can talk to the teachers and families about different mental health topics and how it applies to young children. And then as the director of pediatric mental health, I oversee a pediatric mental health program for the Red Lake Nation here in the Twin Cities. And I oversee a team of 5 therapists, and we provide outpatient mental health therapy for young children.
I was a pretty young teen mom, and I utilized community programming. I was offered a stipend to volunteer. My interest it opened up so much in wanting to know what they were doing, why they were doing it, and developmentally picking up the milestones and how to help your baby grow. The pathways that I took in this role were utilizing a lot of community organizations. I was able to work, go to school, earn money.
I feel like that started at a really young age. I love working with young children, so it was very simple working with babysitting and coaching, but as more of like a professional level, I went into a social work degree, and then following that, I went to work in the field for about a year and decided I wanted to go to a higher level of graduate school. So I went to school at the University of St. Thomas and University of St. Catherine in the clinical social work program, and then I graduated and went into the early childhood mental health field. When I think about what I love about my job, I absolutely love working with the children and families that I get to see every day. I think about all the stories that I've heard throughout my years in working with kids and families, and how resilient they are. And I just think about the hope that lies there in the work. And I also really think about my team and the people that I'm surrounded with and how important that is, and that really helps me to come back into the office every day.
I believe the impact that I'm having is a positive one. Being a familiar face in the community for as long as I have been, it puts people at ease, and they have a trust in me, and I have to uphold that by doing my best in my role.
The impact I hope I'm having in children and families is I hope that they come into my office feeling respected and cared for and honored, and that it's a safe space for them to be.
My advice for somebody who has interest in the early childhood fields is to utilize your community-based programs, talk to your colleagues and your neighborhood people, just looking within rather than so far out. I think a lot of people feel like in order to follow their dream or to seek what they're looking for, they have to look in a bigger scope, when there's a lot of things that are really right here, really close to where you are from.
When I think about what advice I would give to someone who's interested in the pathway that I took, I would encourage them first when they go to school to really explore all the different scholarships and grants that are out there to help support them in that journey. And then also what I would encourage is when they start out in the field to really identify who their mentors are and kind of build a really supportive network around them. That can really help with the longevity and staying in the field, because you're going to need support. You can't do this in a silo. So that would be probably the biggest advice I would give. Raising little children is really hard. So to be able to be there to support the families in a good way and help them build a strong foundation is only going to help our future.